pharmacy team do an outstanding job. We are a small team, but we're quite spread out. So we service Wyong Hospital, Gosford Hospital. We also have some satellite pharmacies in the oncology day unit. We have a number of pharmacists and pharmacy assistants, technicians and administration staff that help us with our service. We all come together and support each other. And I think at the end of the day, all of our staff have the patient at the forefront of their mind. That's what they come to work for. And I think the impact that we have on the patient's journey is extremely positive. We have a real focus on making sure that their stay in hospital is a safe one.
We love coming to work here. We are all friends. We all work really well together. We definitely collaborate very well together. We're open communicators. We all have the patient's best interest at heart, and we all work really hard and are very committed to caring for our coast. We're all locals, we all live around, we're all part of the community, and often the patients we treat are our neighbours, our family, our friends. So we are invested and are just really committed to working together to achieve the best outcomes for our patients.
What I love about our pharmacy team is we all work really well as a team, both technicians and pharmacists. Everyone's really willing to help one another. Everyone's willing to listen to one another's ideas. It makes a big difference working in a team that works so well together, and everyone gets along well with one another. It really makes a difference coming to work every day.
The COVID Community Support Team provides care for COVID-positive patients at home in the community using remote monitoring and a range of virtual care modalities. Our team is made up of casual nursing staff, and these nurses have such a broad range of skills and experiences that they bring to the table. We also have midwives, doctors. We work together really well, and I believe that this is due to the environment of the pandemic creating such a unique time, and our team have been able to come together to support those patients, to keep them safe and to make sure that they have the best care available to them.
So the team is basically a nurse-led model. So they are the backbone of the team. They phone the patients on a daily or twice daily basis, and the doctors are there for backup or professional advice. And as we don't have any COVID specialists, we had to rely on the goodwill of other senior doctors in the community. I've never been involved in anything like this before, and it's really been such a great experience. We've learned so much because we've been stretched beyond what we normally would feel comfortable with. It's been such a welcoming culture in that all of us were in the same boat. We had this very patient-centered focus. We just wanted to help the patients and try to not have them end up in hospital if we could safely do so.
We've received so much positive feedback from patients in the community about our service and the level of respect and care that they feel from the nursing staff. They go above and beyond for their patients.
The COVID vaccination program has been huge. We've vaccinated 149,000 people. Our team was a team of nurses, admin, PSAs and doctors, and together we become one amazing team, a team that was caring for the coast. It's been like the dream team. Everyone has given 100%, but it's just the friendship, and to be able to lead the team of these people has been amazing.
As a PSA, your role was expanded, as in you did things that you wouldn't normally do. It was the same with the nurses. They would do things that they wouldn't normally do, but we all came together. It really didn't matter what background or what your role was, maybe outside of these walls, but coming into the clinic, you all supported each other. It was truly a family. It was just marvellous how we all came together.
One of the massive benefits of this particular team that ran this clinic is the fact that they stayed on point with all of the mandatory education. And the other thing I want to mention too is the cultural appropriateness. This clinic saw so many of our local Aboriginal and Torres Strait Islander community members for their vaccinations, and the appropriateness of the staff was phenomenal.
You would get really nervous patients that would come in, so it was all hands on deck. let's distract that person so that the vaccinator can get in there and do it. It was very refreshing to experience that because it was truly what a team
Should be.
is. Yeah, absolutely.
Yeah.